Hello, everybody. This is Dr. Shikha Agarwal. I'm working as a consultant gynecologist and IVF specialist at Indra IVF Ratlam branch. Today, my topic of discussion is freeze embryo transfer or FET cycle and cryopreservation. But before that, I would fully assume that you people are maintaining full precautions against COVID-19. That is, wearing masks, maintaining social distancing, and washing your hands regularly. Remember, prevention is the best cure against COVID-19. So now, coming back to our topic, that is freeze embryo transfer or cryopreservation. So what does we mean by freeze embryo transfer? And why do we want to freeze the embryos before we transfer it? Why can't we do it fresh? So I would like to tell you to answer this. First, we will know what is a normal IVF. In a normal IVF, when a patient comes to us, what we do is first we do a basic investigation, which comprises of blood investigations, including your CBC, LFT, KFT, your AMH levels, and an ultrasound. In the ultrasound, what we want to see is your antral follicle count. That means how many eggs are recruited for that cycle. Okay, if your AFC count is low, that means you will have less number of embryos. So we first see your AFC count, we see the uterus, how it is, how is the endometrial lining. And after doing your basic investigations and your basic ultrasound, we generally call you on day 2 or day 3 of menstrual cycle, where we start your gonadotropins injections. We continuously give you gonadotropins injections or hormone injections, that is, stimulate you. In that stimulation, we increase or we develop all the follicles which have been recruited during your cycle. Once the follicles reach a certain size, okay, then we give you trigger and extract. After 36 hours, we do a ovum pickup. In that, we extract all the follicles which are of good size. From these follicles, we separate eggs and then fertilize these eggs with your husband's sperm. Once the fertilization process is over, now we have embryos. These embryos are supposed to be cultured. They can be cultured for a period of 2 days, 3 days, or 5 days. In my center, we are culturing the embryos till blastocyst stage. These blastocysts are then assessed and graded. The good quality embryos, that is, the good quality blasts, are generally freezed. The poor quality, that is grade B, grade C embryos, are generally discarded. Now, this is called freeze embryo transfer. In case, as soon as the blastocyst or day 2, day 3 embryos are formed, we transfer these embryos into the mother's womb, then it is called fresh embryo transfer. Now, what is the harm of fresh embryo transfer? Most of the people think, why do we need to freeze it? The freezing will damage the embryos. But my dear, it is not the case. Because to form maximum number of embryos, what we do is we give you supraphysiological levels of hormones, that is supraphysiological levels of gonadotropins. In a normal menstrual cycle, only 1 or 2 follicles develop. But in an IVF cycle, we want maximum number of follicles. So this also actually interferes with your endometrium. So the good quality endometrium is not formed. It may hinder with your implantation. So success of pregnancy, the success of an IVF cycle decreases with then fresh embryo transfer. So it is always better to freeze all the embryos which are formed, the good qualities, the good grade embryos, and then transfer it in next cycle or whenever we find it suitable. It also gives us a chance to prepare your endometrium according to us, because before we see, that is before we assess, that is on day 5 or day 3, we do not know whether you will have good quality embryos or not. Then we also do not prepare our endometrium as we could have prepared. Once we know that we have good embryos in our bank, then we can easily do so many procedures in your endometrium to prepare it, and so that we get good results like PRP. We can proceed for hystro, we can proceed for your DECA injections or any other procedures which is needed to get good quality endometrium. Once the embryo is formed, we freeze these embryos and then we wait for your menstrual cycle. Once your menses comes, we give you different set of medications and prepare your endometrium. And once we find that your endometrium is fit, then we start progesterone injections and synchronize your endometrium with your day 5 or day 3 embryo, and then we transfer it. In this way, we increase the chances of implantation and IVF pregnancy. But someone will ask me then, is it like fresh embryo transfer is complete? No, dear, it is not like that. Some cases, fresh embryo transfers can be considered, which are like supposedly we have only 1 or 2 embryos formed, or the antral follicle count or AFC is very low. In these cases, we can consider going for a fresh embryo transfer. Or in suppose after full ovum pickup, we do not get good quality embryos. We get only B grade or C grade embryos. Then putting the embryos under the pressure of freezing, it is better to do a fresh embryo transfer. It is quite possible that poor quality embryos will not give us pregnancy, but it will be definitely better than no transfer. Apart from this, by doing freeze embryo transfer, we can save ourselves from the life-threatening and dreaded complication of IVF, which is ovarian hyperstimulation syndrome. By doing FET cycles, we are able to reduce the risk of ovarian hyperstimulation syndrome, commonly known as OHSS, by less than 1%. And apart from this, if supposedly we have good number of embryos in our bank, and by chance our IVF cycle fails, then we can use these embryos in our next IVF cycle also. We do not need to go through the procedure of ovum pickup again. And if suppose a pregnancy succeeds, we get a baby, but after 3 to 4 years, we want a second pregnancy, then we can use these cryopreserved embryos for the next pregnancy. So, in short, these eggs, these embryos which are formed are a boon. It can be preserved for a period of 10 to 15 years without any damage, without any problem, and can be easily used for conception. So I would suggest all of you to please go for freeze embryo transfer whenever you are going for an IVF cycle. Nowadays, apart from embryos, it is possible to even preserve sperms and eggs. Egg freezing is generally recommended in cases on the day of ovum pickup if the husband fails to give a semen sample. And then what we do is we preserve the eggs so that whenever sperms are available, then we can actually fertilize those eggs and produce embryos. Or sometimes a lady is supposed to undergo chemotherapy and some other procedure, then we can freeze her eggs. Or sometimes some ladies do not want pregnancy now, but they want to preserve their fertility so that they can use it after some time, after some 5 years, 10 years. That time also we can do egg freezing, that is egg cryopreservation. Nowadays, even semen freezing or semen cryopreservation is a possibility. Again, when we can do it, sometimes, as I told you, on the day of pickup, the patient is not able to produce sperms. So what we can do is, as a precautionary method, we can preserve the sperms 2 to 3 days prior to ovum pickup, so that in case the husband is not able to produce sperms, we can use these cryopreserved sperms. Cryopreservation is actually a boon in IVF cycle. It has totally changed the future and the success of IVF. I would suggest all of you to please do not hesitate to get your embryos, eggs, or sperms freezed in case needed. Thank you.